Assalamualaikum and good day everyone. My name is Jeremy S. Mama and we are going to discuss the ethical issues on global COVID-19 pandemics together with my co-reporters, reporter Rahim Septula. The reference of our report taken from Cleveland Clinic Journal of Medicine. The care of patients during the COVID-19 pandemic has added many layers of complexity to ethical issues. Our response emphasized the importance of having an ethical sound framework to inform our decisions, requiring caregivers to consider what is ethically optimal and feasible for the patient. It is increasingly important to understand the ethical principle and to appropriate apply them to both patient management decision and guide scarce resource allocation. Clinical ethics during a pandemic. Challenging ethical issues in healthcare are common because center of our role as caregiver is the relief of human suffering. Reviewed on a global scale, ethical issues surrounding pandemics are not unique to our healthcare system. Neither are the ethical issues surrounding scarce resource allocation. As part of an anticipated response to the effects of the COVID-19 pandemics, the importance of having an ethical sound framework to inform our clinical decision cannot be emphasized enough. During this time, healthcare leaders are asked to engage in proactive planning where addressing worst case scenarios is the first step to reducing morbidity, mortality, and other undesirable effects of an emerging public health emergency. Population health versus individual rights. A public health emergency such as a surplus of people seeking healthcare as well as critically ill patients with COVID-19 or another severe respiratory illnesses requiring admission to the intensive care unit or ICU disrupt normal process for supporting ethically sounded patients care due to the steeply rising supply-demand gap for treatment supportive measurement. The ethical framework in a public health crisis shift to the promoting the health of the population by using resources possibly to maximize the total number of lives saved. So, understanding the guiding principles surrounding public health ethics may help promote trust and alleviate moral distress and burnout in bedside providers under austere circumstances. So, the focus of public health ethics can require a limitation on individual rights and preferences due to need to prudent use of resources and strategies. This limitation must be consistently and equitable applied, be proportional, necessary, and relevant. So next, priorities of healthcare providers. During pandemics, the priorities of healthcare providers shift in these priorities create competing obligation for providers who are naturally geared toward focusing on their individual patients. So, policy planners are asked to consider the two of the competing ethical obligations that must be held in balance. For the sake of the brevity, we only consider the two primary obligations listed here but concede that other ethical obligations exist. So first, duty to care. Duty to care, relief of suffering, and respect for the rights and preferences of patients, which is focus of ethics consultation services. So next, duty to promote equity and moral equality. Fairness relative known to need in the distribution of the risk and benefits of care provision in society, which is the focus of healthcare ethics. And ethical reasoning thus requires caregivers to consider what should be ethical, optimal, or feasible for the patients. This is known as um, the crisis standard of care, a recognition of limitation during time of scarcity. In addition to duty to care and fairness, this ethical guidance is also based on duty to steward resources, transparency, consistency, proportionality, and accountability. As an ethical concept, it offers concrete guidance for a system-wide response to a disaster addressing allocations. So next, ethical principles regarding scarce resource allocation. Majorly anticipated ethical dilemmas is the allocation of finite resources defined as measures rationally or means by which resources or access to care is obtained by individuals to exclude others in a time of crisis. Estimates indicate that a moderate pandemic would infect 64 million Americans and necessitates hospitalization of 800,000, or it would be percentage 1.25%, with 160 needing space in the intensive care unit. With dwindling resources as hospitals approaches surge capacity, it is likely that an increased need will cause competing for resources such as testing personnel, protective ventilators, vaccines, and ICU beds. Ethical principles that guide resources allocation are well described in the literature.